I'm going to start the webinar here at the top of the hour. See you in there. All right. Thank you so much for joining us today for our WICHE Spotlight on the Professional Student Exchange Program and Veterinary Medicine Advisory Council, with a special presentation on Colorado Proposition 129. WICHE Spotlights are bite-sized 30-minute webinars in which we share programs, initiatives, grants, and research from across WICHE's 4 units. I want everyone to be aware that attendee microphones and videos are turned off, but you are welcome to leverage the chat or Q&A to submit questions. While we will not have time to answer questions live, a summary will be sent out after the call, along with slides and links from the presentation. With that housekeeping taken care of, I'm pleased to introduce our 2 speakers today. Dr. Wayne Jensen is a professor in the Department of Clinical Sciences at Colorado State University and has more than 30 years of experience in the animal health industry, including veterinary medical practice, research, product development, business development, and research grant funding, and has been pivotal in the development of CSU's new Veterinary Professional Associate program. We are also joined by Margot Colalancha, Director of WICHE's Student Access Programs. Margot has extensive international higher education policy experience that led her to the work that she does with WICHE in expanding access to higher education through the Western Undergraduate Exchange Program, the Western Regional Graduate Exchange Program, and the Professional Student Exchange Program. Thanks to both of you for joining us today. Margot, I'll turn it over to you to introduce us to the Professional Student Exchange Program.
Thank you, Olivia. It's a pleasure to be here. Hello, everyone. Real quickly, the Professional Student Exchange Program, or PSEP as we shorten it, was WICHE's very first program, and we actually have records of the first students exchanged as early as 1953. So that's 72 years ago, which is quite a while. The Western governors met after World War II ended, and they agreed there was a shortage of healthcare professionals in the Western U.S. Many of our states didn't have professional healthcare programs in fields like dentistry and veterinary medicine and medicine. And so our states had these workforce shortages and needed to educate professionals to fill these roles. And I also want to point out, it was financially prohibitive for some of the states with smaller populations to open their own professional programs. So the have states agreed to share with the have-nots, and WICHE created an arrangement whereby states could appropriate funds to help reduce tuition for their students in those high-need fields. And the enrolling programs agreed to reserve spots for qualified students from neighboring states. So this academic year, 556 students enrolled through WICHE's Professional Student Exchange Program across 10 different healthcare professions. And their sponsoring states invested over $15 million to reduce their tuition. Since the program's inception, over 16,000 students have graduated from WICHE's partner PSEP programs. And veterinary medicine has always been one of the most popular fields in WICHE's program. Almost 4,000 of those 16,000 plus graduates received their doctorate in veterinary medicine as a quote unquote WICHE student. And Colorado State University's veterinary program, which was founded in 1907, has always played a key role in PSEP. It was the first veterinary program to partner with WICHE. And of the 5 colleges of veterinary medicine that we've worked with since the beginnings, CSU has graduated the most WICHE veterinarians. In the 1970s, the shortage of veterinarians became very acute in the West. And so collaboration among the sponsoring states and enrolling CVMs became increasingly important. In 1977, WICHE members founded the Regional Advisory Council on Veterinary Medicine, which we now refer to as a Vet Med Advisory Council. And this year, the council will celebrate its 48th year in existence. So it's comprised of 2 members from each WICHE member state, 1 voting and 1 non-voting. And the members of the council are typically professional veterinarians. They might be pre-vet student advisors from the ag colleges of states that don't have their own vet school. They might be a state legislator or an executive director or president of the state veterinary association, or they'll have some professional connection to the field of veterinary medicine. They're appointed for 3-year terms by the WICHE Executive Committee member from their respective state. And we also have deans and admissions staff of cooperating veterinary colleges in the WICHE state. And they are also members along with WICHE staff. So the colleges and WICHE staff are ex officio members. I got to tell you, it's a great group. The members genuinely look forward to seeing each other at our annual meetings. And although the partner colleges of VetMed are competitors, there's really a collegial and cooperative relationship among the members, and we meet annually in June. So a few weeks ago, I came across a paper of one of our CUSU representatives, Dr. Sherry Stewart, and she shared that with us at our June 2008 meeting in Fort Collins. And it was titled Veterinary Professional Associate, VPA, a Concept Paper. Is it time for the veterinary profession to consider creating a position equivalent to a human health physician assistant or healthcare professional? And here we are, 16 plus years later, and the Veterinary Professional Associate is on track to become a reality here in Colorado and possibly in other states in the future. And we're absolutely delighted to have Dr. Wayne Jensen here with us today to tell us more about this historic development in veterinary care. Wayne, it's yours. The floor is yours.
Well, first, thank you very much for the opportunity to talk about the VPA programs that we've developed at Colorado State University. I want to give credit right up front to Dr. Sherry Lanning, who's been my partner in the development of this program. And also, I know that there's limited time for questions, but our emails are there. So if you do have any questions, feel free to reach out via email. Next slide, please. So I'm going to spend most of my time actually talking about the VPA and the VPA program, how we developed it, what we did, and what it is. We'll spend some time at the end on Proposition 129. Disclaimer, I had nothing to do with Proposition 129. I was aware of its development. I know why it was developed, and I could talk about that, but I was not, as a state employee, we were certainly not allowed to advocate either for or against any legislation. I wasn't directly involved. Next slide, please. Okay, as was just mentioned, the term Veterinary Professional Associate, which originally coined by Dr. Sherry Stewart and Lori Kogan, and they published this in the Journal of Veterinary Medical Education back, actually was published in 2009. Obviously, the white paper was before that, but it was published in 2009, where they did describe about a mid-level practitioner modeled after PAs that could be employed to handle routine veterinary care, allowing veterinarians additional time to focus on the more demanding and challenging aspects of veterinary medicine. Next slide, please. Coincidentally and independently, Dr. Frank Gehry, who's also a professor at Colorado State University, published the following year, in 2010, in Western Dairy News, and he published a similar concept where he said, there are many places we could employ animal health paraprofessionals, much as our colleagues in human medicine do, and substantially improve the delivery of livestock health care. Now, Dr. Gehry, it's a personal story with him because his mother was actually a physician, and he saw how her life changed and also their ability to provide human health care changed when she employed a physician assistant. She had a better quality of life, and they were to increase their delivery of health care. So he had firsthand knowledge of that, so to speak. Okay, next slide. And then similarly in 2011, so very similar to this time frame, the National Research Council in their report on workforce needs in veterinary medicine had the following: in rural areas where primary veterinary care is needed but too few farms to support full-time veterinarians, a system of animal health care involving rigorously trained technicians under the supervision of veterinarians could be developed. Next slide. So that's where we were. That idea arose from several different sources, and it coalesced around this concept that and we stayed with the term originally coined by Drs. Stewart and Kogan, Veterinary Professional Associates. VPAs, it's important that we believe they shall work under the supervision of a licensed veterinarian. Now, they'll be different from or distinguished from certified veterinary technicians, registered veterinary technicians, in that their education will also emphasize competencies in the assessment and identification of abnormal findings, and importantly, the development of diagnostic and treatment plans for routine conditions. In this way, it's expected that VPAs could expedite care, decreasing the workforce gaps. In addition to their training on basic medical and surgical needs, they'll also be trained, to emphasize competencies in client communication and leadership. All right, next slide. Now we'll talk about, oh, that went backwards. Can we go to the next slide? Somehow we jumped. Yeah, one more there, one more forward. There we go. How did we do this then? We took that old sort of umbrella concept, and then we met with a group of stakeholders, and they came from many walks of life. You know, they came from practice, they came from academia, they came from industry. And we said, well, if we're going to have this mid-level practitioner, what are the competencies that we would expect them to be capable of? So we started with the list, identifying the competencies. And I'm not going to go line by line here, but these are there for your information in the future. But these were general competencies. We got more specific in the next slide, next several slides, but we'll go. We talked about preventative care. What were the competencies that would be necessary in a preventative care situation? Next slide. In the diagnosis and treatment of uncomplicated medical conditions. So these were a number of conditions, and recognize that, you know, these are the uncomplicated medical conditions. And many of the times, like using cardiac disease, the first one on the list there, and maybe the diagnosis of the cardiac disease. But again, these individuals work under the supervision of a veterinarian. They're also trained to learn to say, okay, these are the cases I need to refer, in-house referral to my supervising veterinarian, or even recommending referral to specialists. So these are uncomplicated conditions, not complicated medical conditions. Next slide. Similarly, uncomplicated surgical condition. There's a list there, and I'll call out the third from the bottom there, castration and spays. Many individuals, and this has been one of the conflicts, so to speak, or one of the controversies around VPAs, is whether or not they should be spaying animals. And I think it's really important that recognize that first, it would be delegated by a veterinarian. So the veterinarian has to have confidence in their competence, but also there's a lot of case selection here. They wouldn't be delegated a case that was expected to be a complicated spay, but rather these would be on the normal, young, healthy dogs and cats. And so we can train for this. And it was really important, and some of the stakeholders were from the shelters, and we'll talk more about that, because this original position was designed to work in shelters. And we'll come back to that. But it was very, very important to them, because that's where one of the workforce gaps really exists, is in shelter medicine and their ability to spay and neuter these animals before adoption, because some states require that to be done before adoption. And if they can't do it, if there's any delay in that, it just costs the shelters more money to house the animals while they're waiting for the spay or the castration. All right, next slide. So as I said, these original positions, or the original concept, was that these these individuals would work in shelter medicine. And the reason for that is basically that shelter shelters are exempt from the Practice Act, the Veterinary Practice Act in most states. That exempt, there's one primary exemption and it was built into most practice acts to exempt livestock owners was the reason it was there. It basically says if you own the animals, you're exempt, or your employees are exempt from the Veterinary Practice Act. Well, because shelters own the animals, that's the reason for their exemption. So even without a change to Veterinary Practice Act, in most states, VPAs would be able to work under the supervision of veterinarians in shelters. So we wanted to focus on that. And when we started this program, that was our focus. Next slide. But since we had put together this list, these stakeholders, we did come out and say, well, if there was the possibility for having a VPA in livestock, well, then these would be the competencies of that. So we took these competencies then, specific for dogs and cats, because again, we were focused on shelter medicine. We took this list of competencies and we then went to our veterinary, the curriculum for our DVM program. And we went and said, all right, if we look at, say, strictly small animal, so those things that apply to dogs and cats, we excluded exotics in the DVM program. And then we said, all right, at what level do we need for individuals to be competent in the diagnosis and treatment of uncomplicated disease, medical and surgical conditions? So we excluded everything livestock, we excluded everything equine and exotics, and just focused on dogs and cats. And again, then just focused on the routine health conditions for those animals. And that's how we came up with the curriculum, which shows up on the next slide. Oh, before I go there, I forgot, I did mention, in addition to non-clinical competence, or in addition to the clinical competencies, we came up with another long non-clinical competencies that included leadership training, communications, client-patient care coordination, critical thinking, and business acumen. So those were also included. So then, all right, on to the next, what we had with the curriculum. Before we get to the details of the curriculum though, as we were devising the curriculum, we said, okay, we can administer this in 5 semesters, all right? And we looked at the curriculum and said, we could deliver 3 of those 5 semesters online. Now, this was very important to us for a couple of reasons. One was to try to minimize the cost of the program, keep the cost as low as possible. And 2, to allow individuals who were currently working to also participate in the program, or at least start the program. But we also realized in doing this that we couldn't do everything in an online environment. So we said, all right, for 1 semester, we aggregated it into 1 semester. We have to have them physically present in Fort Collins, and we'll see for the techniques labs. And in the last semester then, it was designed to be an internship where they can take the knowledge and the skills that they gain in the program and put them all together. Okay, so next slide. So I won't go by the curriculum. I'd just like to point out though that the semesters, the first semester, 14 credit hours, second semester, 13 credit hours, and these 2 are delivered online. Next slide. The third semester also delivered online, 13 credit hours. Then the 4th semester is the in-person, and you can see those are all techniques laboratories. And that is, and then the last semester, next slide, is the internship. And I think it's really important to highlight that the total credit hours here is 65. I'm sure most in the audience are aware that the minimum for a master's degree is 30 credit hours. So this is not your typical master's degree. This is twice the number of credit hours that most master's degrees are. But that's what's necessary to train the individuals to the level of the competencies we determined were necessary for this position to be successful. Next slide. Okay, so where are we in this? Well, I can say we started the approval process in December 2023, and we finally got our final approval from our Board of Governors in February of 2025. We hope to enroll the first class this fall, and I say hopefully because we've got to hire faculty to actually administer the program. And as many in the audience are likely aware, hiring faculty in academic institutions can be a slow process. And so we're hopeful. We're just about to announce the positions, and if we get them filled soon enough, then we'll be able to enroll the first class in 2025. And if not, we'll enroll the first class in the spring semester of 2026. Next slide. Okay, so now I've actually got quite a few what I refer to as frequently asked questions to just kind of address here. And this is, in going through the process, questions that we've had is like, why are you doing this? And so I thought some of these might be useful to just kind of explain the why. So first, how will VPAs address the shortage of veterinarians? And it is because their expectation is that they will assume responsibility for much of the routine care currently provided by veterinarians that allows those veterinarians to focus on more complex medical conditions. And I go right back to the original publication by Dr. Stewart and Kogan, and this is right out of their abstract. This was what their vision showed. So recognize that little asterisk. Proposition 129 requires Colorado to modify the Veterinary Practice Act. Prior to the passage of Proposition 129, again, students would have been, or graduates would have been restricted to working for shelters because of the shelter exemption for the Practice Act. Next slide. How might VPAs also address the cost of veterinary care? Well, this one, for those familiar with business in the audience, recognize that labor is the #1 cost of all businesses. So VPAs would help address the cost of veterinary care by allowing practices to use lower salaried professionals, importantly with lower educational debt, to provide that routine care. Next slide. So this is one that a very frequently asked question. Why not address the fact there are not enough veterinarians rather than adding a new position? Because we could. I mean, Colorado is one of those that's expanding its class size. There's also several programs that are in the proposal stage that will likely at some point become approved, and that's going to increase the number of DVMs. There's a number of economic studies. I refer you to the American Association of Veterinary Medical Colleges. They have probably the one that's been reviewed the most, that shows that even if you project the increase from all the new programs and the expanded class size, there's still an expectation that we're still about 25 to 30% short of the number of DVMs needed to address access to care issues in our profession. Additionally, from my perspective, I mean, the cost of training DVMs is significant. And I define that cost as the average student loan burden that graduates have. And if we're focusing exclusively on providing routine care to our less affluent clients, we can't ask our graduates who are with that level of debt, we can't put that burden on them and say, oh, we know you have all that debt, but we want you to provide low-cost veterinary care. We can't do that. Next slide. Okay, another frequent asked question, why can't we use certified veterinary technicians to more appropriately fill the gap? And the answer is yes, we do need to increase our utilization of technicians. But we've also been talking about that for decades, almost since I graduated from veterinary school. Even if we were to fully utilize technicians, however, we still would not close the workforce gap sufficiently to not need VPAs. And one of the reasons for that is CVTs, they're not trained to develop diagnostic and treatment plans. So they can't manage those routine medical and surgical conditions. So that the bottleneck currently is the veterinarian, and the bottleneck will continue to be the veterinarian until we get them, until we have VPAs to help manage some of those services. Next slide. Will there be a licensing and credentialing exam? Yes. After passage of Proposition 129, the American Association of Veterinary State Boards has agreed to develop a credentialing exam for the state of Colorado. Until it's available, and it may be available at the time of our first graduates, that's kind of a to be determined, but until it's available, we designed our program to be a Plan B master's program. So the Plan B programs require a comprehensive final exam as part of the master's program. And that's what we'll use to ensure competency of the graduates. Next slide. Will there be a national organization to accredit VPA training programs? And the answer to that is also yes. So there's a coalition for the Veterinary Professional Associate. You can see the website there if you're interested in seeing more about it. That coalition has become an associate member of the Commission on Accreditation of Allied Health Education Programs, or CAHEP, and they've established an accreditation committee with CAHEP for the VPA profession. Now, CAHEP does require the existence of 3 programs with enrolled students before they will start the accreditation process. And we have now identified those 3 programs. It's just not all 3 have enrolled students. Colorado will be the second one with enrolled students, and then a third one will be following shortly along. So next slide, please. There is great need in rural America where a mid-level practitioner could benefit large mixed animal clinics. Is there plans for a focused, large animal focused VPA degree? Again, the answer is yes. As I explained, the initial program was focused, or is focused, on training for dogs and cats because of the shelter. Now that Proposition 129 has passed, we are able to plan for development of a curriculum for large animal or mixed animal clinics, but it will be a separate curriculum, because to look at delivering that level of knowledge base and technical expertise in 5 semesters, we can't do it and include large animal into the small animal program. So it will be a separate program. There'll be overlap. There'll be significant overlap, but there will be large animal focused knowledge classes that sort of will be in addition to the small animal. So for those that wanted to do mixed animal, they would have to do both. Next slide. All right, so that's done with what is a VPA. How about Proposition 129? Again, I wasn't involved in it. I was aware of it. I will say that the reason, because this has also been a question, why didn't this go through the state legislature? Why was it put to the voters of Colorado? And I mean, the reason's pretty simple. I mean, the group that supported the Proposition 129 supported initially going through the state legislature and, excuse me, had identified bipartisan sponsors, so sponsors from both parties in both the House and the Senate, but their bills, they were blocked at the committee level because, excuse me, I'm getting over a cold. they were blocked at the committee levels because the chair of one of the committees was not an advocate of this concept and just never allowed it to come up for a hearing at the committee. So the supporters of that went with the citizen initiative, and I guess I'm running out of time. So I will just briefly say, oh, next slide is just talking about the rest of them. Oh, it shows for your information, the title on the next slide. So that is the title of the proposition. And then for the next slide, we can just finish up, and I'll talk briefly about criticism of the legislation. Yes, as I mentioned, some people said it shouldn't have gone through a citizen initiative. It should have gone through the legislature, but it was blocked from doing there. There's the AVMA has been highly critical of this. It's trade protectionism at its finest. Yeah, not much more to say about that. I mean, they spent almost $3 million trying to block Proposition 129 or to make it fail. That was like 8-to-1 spending over the group that were proponents for it, and it still passed by more than 5% of the vote. Is there excitement around the legislation? Yes, from a number of groups. What do schools need to consider if similar legislation comes to their state? Well, if schools are interested, we are developing with the accreditation process. We will have a sort of template the schools can use to develop their own VPA programs. And I will say I am always willing to help with that if anybody's interested. And so with that, I will be quiet, and I haven't checked the chat if there's any other questions.
Thank you so much, Wayne. We knew that this was a really big topic to try and fit into just 30 minutes. So I appreciate how efficient you've been with us today. And certainly if we have follow-up questions or we want to bring you back to talk about any part of this in detail, we will make that invitation. So we truly appreciate you being here today. Thank you also to our attendees who have hung in here a little bit past the hour. And thank you to Margot Kolalancha for bringing the topic to our audience and sharing information about PSEP with us. I wish I had more time to speak with both of you today. I also, of course, need to thank both our hosts and our sponsors. Today's programming was brought to us by WICHE's Academic Partnerships, which are affinity group for chief academic officers in the West. And we hope that you'll be able to join us this year, actually, for our annual meeting, which is upcoming in Reno, Nevada, on April 23rd through the 25th. So that's coming up right around the corner. If you have any interest in joining us, I've dropped our registration link in the chat. I also, of course, appreciate if you would be able to give us feedback on today's session with today's survey. So once again, thank you to Wayne. Thank you to Margot. We appreciate you so greatly. And thanks for sticking with us. We'll hope to see you in Reno in April. Bye-bye.
Bye-bye.